The position of the patient for your surfacotomy is of importance. We position the patient in the prone position, and we place a pillow underneath the lumbar spine to decrease the amount of lordosis of the lumbar spine. And that allows easier palpation when you evaluate your patient. Also notice the position of the arms along the trunk to avoid a tension of the thoracolumbar fascia, which also made it more difficult to palpate the bony structures. Now, what are we going to palpate? The first structure that I will be palpating is the iliac crest. I'll be following the iliac crest to the inferior border of the PSISs. Those are very important area for testing later. Those PSIS have been reliably shown to be at the level of S2 spinous process. So from that level of the S2 spinous process, I'll move up and identify the spinous process of the other lumbar vertebra. From there also, I will go caudal and find the spinous process of S3 and S4 down to the sacral horns of the sacrum. Then I'll draw some helper's line going from the middle of the PSIS to the sacral horns and identify the borders of the sacrum. From there, I'll also identify the superior border of the greater trochanter, and I'll join some lines from the PSIS and the sacrum to that cranial border of the greater trochanter to identify the piriformis muscle. So, as usual for surfacotomy, you, with your fingers, you're going to go from a cranial to a caudal direction until you hit the first bony area, your iliac crest. The height of the iliac crest is variable between subjects. The reason why we will more reliably find our spinous processes using the PSIS area. So here, as you come to the posterior superior iliac spine, you can use your thumb perpendicular to the inferior border of the PSIS. And here the lateral border of the PSIS. Can do the same on the other side. And here again the lateral border of the PSIS. Between those inferior border of the PSIS, you'll draw a line. And in the middle, the closest spinous process that you find between those helper's line is your S2 spinous process. It's variable in height, so sometimes it's pretty flat. It's not always very easy to palpate. From the S2 spinous process, you'll go to the S1 spinous process, also small spinous process. Some folks almost have no spinous process at the S1 area. It just goes up on the sacrum until it drops down. In her case, there's a spinous process here of S1. From that area, you'll identify then the spinous process of L5, small spinous process of L5, and you can palpate it from the top, and then you can palpate this spinous process also from the lateral aspect. This might help you for the identification of the spinous process, as there's a lot of architectural differences or variation between subjects, and some spinous process have variability in their shape. So sometimes if you follow indentation, to avoid to count more spinous process that they are, just go on the lateral aspect to find the interspinous process space. So here, then I find my L4 spinous process. L3. L2. L1. And then here, the smaller spinous process of T12. What you can also, to help you identify the spinous process, if you position your thumbs on the dorsal aspect of the spinous process, as you push on S2 and S1, it is very firm. As you come on the L5 spinous process, it's a lot softer. It has a give to it. Also, the distance between the spinous process should be about the width of the thumb for each spinous process for their spatial area. From the S2 spinous process, you'll then follow to S3 spinous process, then L4, S4 spinous process, and then if you keep going in a caudal direction, on the side you'll feel some little bony protuberance, and those are your sacral horns, the sacral cornua. Between the sacral horns is located the sacral hiatus, an area where the needle of the anesthesiologist is inserted for caudal catheter series, for example. So from those sacral horns to the middle aspect of the inferior border of the posterior superior iliac spine, you'll draw a Harper's line. Just caudal and lateral to this Harper's line, about 1 inch, caudal and lateral, you'll feel the border of the sacrum. So the border of the sacrum will be a little bit caudal and lateral to this Harper's line. If you go then in the lateral direction, you can identify your greater trochanter. On the bone, on the greater trochanter, you're going to push and feel it's hard, and then when you come off the greater trochanter, it's becoming soft. You need to identify the tip of the greater trochanter. To confirm the location of the greater trochanter, you may also flex the knee and produce internal external rotation of the hip, and you'll feel the greater trochanter moving on your fingers. If you are too cranial, you won't feel any movement. Again, you need to find the cranial tip and then the posterior border of that greater trochanter and anterior border of that greater trochanter. You'll divide the greater trochanter in two on the tip, and you'll draw a line referred to as line A from the middle tip of the acromion to the middle of the posterior superior iliac spine. This helper's line that you draw from the posterior superior iliac spine to the sacral horn, you'll also divide in 3 equal parts. From the first cranial 2/3 of this helper's line to the tip of the greater trochanter is the location of the piriformis. For the ischial tuberosity, it's going to be on the buttock, on the inferior aspect of the buttock, and pretty medial. So what you're going to take is or your index finger or your thumb, and you're going to push into the buttock until you feel a bony prominence. In this case, here's the bony prominence of the ischial tuberosity. Now, if you release the soft tissue of the buttock and you put your mark here, you're going to be too inferior. So as you feel your ischial tuberosity, you need to mark your point back at the level where the bone is located. So I pushed here, found it right here. So here I'm going to put my mark where the bone is located. From that ischial tuberosity, which is wider than what we think it is, we're going to draw a line from that ischial tuberosity to the tip of the greater trochanter. This is referred to your notebooks as line C. The second line, caudal line of the piriformis, was referred to as line B, and the first one as line A. Now, why do we need all these lines? Is to help us to find our nerves. So we're going to identify the sciatic nerve, superior gluteal nerve, and inferior gluteal nerve. To do that, we'll need to divide line A in 3 equal parts. Line A going from the inferior border of the PSIS to the greater trochanter. That cranial third, or the most medial third, is going to be the area of the superior gluteal nerve. And if you press in that area, it's usually an area of tenderness to the patient, not really a trigger point, but just an area where the superior gluteal nerve is piercing above the piriformis. Then you can identify your sciatic nerve by dividing line B in thirds and line C in half. Your sciatic nerve will be, the trajectory of the sciatic nerve will be from this third portion of that line B toward a half of that line C. So lateral to the ischial tuberosity, and then it goes down the lower extremity. So it passes lateral to the ischial tuberosity. So that's your sciatic nerve. And then to identify the inferior gluteal nerve, you will draw a line from your PSIS I'll say an imaginary line, or you can draw the line from your PSIS to your ischial tuberosity. Between half and 2/3 down the PSIS, between half and 2/3, you'll find the inferior gluteal nerve. And through palpation in this area, you can identify which part will be painful, where the inferior gluteal nerve exits the underneath the piriformis, and its tender will be the area of the inferior gluteal nerve. So to finish the surface anatomy, a few landmarks might be helpful to identify in your clinic. Identify the lateral border of the sacrum. We say it's about 1 inch caudal and lateral to the helper's line. So here you have your border of the sacrum. As you go more in a cranial direction and you push, then your finger will be pushed away to the lateral side. This is the area of the PIIS. As you curve caudally, then your sacrum will curve more in a medial direction. In that area will be the lower angle of the sacrum. Now, going from the PSIS along the sacrum is your long dorsal sacroiliac ligament. So I'll draw this one in red. So here's your long dorsal sacroiliac ligament. This ligament is the only ligament to be tied into contranutation, so often painful with pregnancy. So one of the techniques that we utilize if a patient have pain in that area, very tender, we do transverse friction massage going from cranial medial to caudal lateral in the area of pain.